Question 1. A pediatric nurse is conducting a well-child assessment on a healthy 2-month-old infant. The parents express concern because their infant does not yet sit independently. Which developmental milestone should the nurse expect to observe in a normally developing 2-month-old infant? A. Sits without support and transfers objects between hands. B. Rolls from back to abdomen consistently. C. Lifts head and chest while lying prone and exhibits a social smile. D. Walks while holding onto furniture. Answer. C. Lifts head and chest while lying prone and exhibits a social smile. Rationale. At approximately 2 months of age, infants begin demonstrating improved head control, lifting the head and chest during tummy time, and developing a social smile. Independent sitting occurs much later, usually around 6 months. Question 2. A nurse is evaluating a 4-month-old infant during a routine developmental screening. Which finding indicates appropriate gross motor development? A. Pulls to stand and cruises along furniture. B. Rolls from abdomen to back and maintains steady head control. C. Walks independently across the room. D. Jumps with both feet off the floor. Answer. B. Rolls from abdomen to back and maintains steady head control. Rationale. By 4 months, infants commonly demonstrate good head control and begin rolling from prone to supine. Walking and jumping are toddler milestones. Question 3. A pediatric nurse observes a 6-month-old infant during a wellness examination. Which behavior is most consistent with normal developmental expectations? A. Uses 2-word phrases. B. Sits with minimal support and transfers objects from one hand to another. C. Rides a tricycle. D. Copies geometric shapes. Answer. B. Sits with minimal support and transfers objects from one hand to another. Rationale. 6-month-old infants commonly sit with support or briefly independently and transfer objects between hands. Language and advanced motor skills develop later. Question 4. A nurse is educating parents of a healthy 9-month-old infant. Which developmental milestone should the nurse identify as expected at this age? A. Builds a tower of 6 blocks. B. Uses scissors effectively. C. Pulls to stand and demonstrates a pincer grasp. D. Reads simple words. Answer. C. Pulls to stand and demonstrates a pincer grasp. Rationale. Around 9 months, infants pull themselves to standing positions and develop an immature pincer grasp, allowing them to pick up small objects. Question 5. A pediatric clinic nurse assesses a 12-month-old child. Which developmental finding would require additional evaluation? A. Pulls to stand. B. Cruises along furniture. C. Does not attempt to sit independently. D. Uses a pincer grasp. Answer. C. Does not attempt to sit independently. Rationale. Independent sitting should be achieved long before 12 months. Failure to sit independently at this age suggests possible developmental delay. Question 6. A nurse is teaching newly hired pediatric staff about expected developmental milestones. Which milestone is most characteristic of a 12-month-old child? A. Walks independently and says 1 to 3 meaningful words. B. Writes first name. C. Hops on 1 foot. D. Counts to 10. Answer. A. Walks independently and says 1 to 3 meaningful words. Rationale. Around 12 months, many children begin walking independently and use a few meaningful words besides mama and dada. Question 7. During a developmental screening, the nurse asks parents about stranger anxiety. At which age is stranger anxiety most commonly observed? A. Newborn. B. 2 months. C. 8 months. D. 5 years. Answer. C. 8 months. Rationale. Stranger anxiety typically appears around 6 to 8 months and is considered a normal social-emotional milestone. Question 8. A nurse caring for a 15-month-old toddler expects which developmental achievement? A. Walks independently and scribbles spontaneously. B. Reads simple books independently. C. Ties shoelaces. D. Performs multiplication. Answer. A. Walks independently and scribbles spontaneously. Rationale. 15-month-old toddlers generally walk well, explore actively, and begin spontaneous scribbling. Question 9. A parent of an 18-month-old child reports concern that the child frequently says no and insists on doing things independently. Which response by the nurse is most appropriate? A. This behavior indicates cognitive impairment. B. This suggests severe social dysfunction. C. This is a normal developmental characteristic of autonomy. D. Immediate neurological evaluation is necessary. Answer. C. This is a normal developmental characteristic of autonomy. Rationale. According to Erickson, toddlers develop autonomy versus shame and doubt, often expressing independence and saying no. Question 10. A nurse assesses an 18-month-old child. Which developmental milestone is expected? A. Uses approximately 10 to 25 words and runs clumsily. B. Writes complete sentences. C. Solves algebraic equations. D. Rides a bicycle without training wheels. Answer. A. Uses approximately 10 to 25 words and runs clumsily. Rationale. Around 18 months, toddlers typically have a growing vocabulary and begin running, although coordination remains immature. Question 11. A pediatric nurse is conducting a developmental assessment of a 24-month-old toddler during a routine wellness visit. The parent reports that the child frequently uses short phrases and enjoys imitating household activities. Which developmental finding would the nurse identify as most consistent with normal growth and development at this age? A. Uses 2 to 3-word phrases and follows simple commands. B. Speaks in complete paragraphs and understands abstract concepts. C. Reads simple books independently. D. Performs long division calculations. Answer. A. Uses 2 to 3-word phrases and follows simple commands. Rationale. By 2 years of age, toddlers commonly combine words into short phrases, follow simple instructions, and imitate adult activities. Advanced language and academic skills occur much later. Question 12. A nurse is evaluating a 2-year-old child during a developmental screening. Which gross motor milestone should the nurse expect to observe? A. Climbs stairs with both feet on each step and kicks a ball. B. Balances on one foot for 10 seconds. C. Skips alternating feet. D. Performs cartwheels independently. Answer. A. Climbs stairs with both feet on each step and kicks a ball. Rationale. At 2 years, toddlers commonly kick balls, run, climb furniture, and ascend stairs using both feet on each step. Question 13. A nurse assesses a 30-month-old child. Which finding indicates age-appropriate fine motor development? A. Builds a tower of 8 blocks and imitates vertical lines. B. Writes cursive letters. C. Uses a ruler accurately. D. Types complete sentences on a keyboard. Answer. A. Builds a tower of 8 blocks and imitates vertical lines. Rationale. By approximately 30 months, children can build larger block towers and imitate simple lines and shapes. Question 14. A parent asks when most children begin to engage in parallel play. Which response by the nurse is most accurate? A. During infancy. B. Around toddlerhood. C. During adolescence. D. During middle adulthood. Answer. B. Around toddlerhood. Rationale. Parallel play is characteristic of toddlers, who play beside other children without extensive interaction. Question 15. A nurse is assessing a 3-year-old child during a preschool physical examination. Which developmental milestone should the nurse expect? A. Rides a tricycle and speaks in 3 to 4-word sentences. B. Solves complex mathematical problems. C. Drives a battery-operated vehicle safely in traffic. D. Writes complete paragraphs. Answer. A. Rides a tricycle and speaks in 3 to 4-word sentences. Rationale. 3-year-olds commonly ride tricycles, speak in short sentences, and engage in imaginative play. Question 16. A nurse evaluates a 3-year-old child who cannot jump with both feet and frequently falls while walking. Which interpretation is most appropriate? A. This finding is fully expected at age 3. B. The child may require further developmental evaluation. C. The child is demonstrating advanced motor skills. D. The assessment finding is unrelated to development. Answer. B. The child may require further developmental evaluation. Rationale. Most 3-year-olds can jump with both feet and demonstrate improved balance. Persistent gross motor difficulties may warrant further assessment. Question 17. A preschool nurse is assessing a 4-year-old child. Which milestone is expected? A. Copies a square and balances briefly on one foot. B. Solves algebra equations. C. Writes complete essays. D. Demonstrates adult-level coordination. Answer. A. Copies a square and balances briefly on one foot. Rationale. 4-year-olds can copy simple geometric figures, balance on one foot for several seconds, and perform increasingly coordinated movements. Question 18. A nurse observes several children in a preschool classroom. Which behavior is most characteristic of associative play? A. A child plays alone with blocks. B. Children play independently without noticing each other. C. Children share toys and interact while pursuing similar activities. D. Children engage in organized team sports with formal rules. Answer. C. Children share toys and interact while pursuing similar activities. Rationale. Associative play involves interaction and sharing among children but lacks the organized structure seen in cooperative play. Question 19. A nurse is teaching parents about language development. Which speech pattern is expected in a 4-year-old child? A. Vocabulary of several thousand words with understandable speech. B. No understandable words. C. Only crying for communication. D. Single-word communication exclusively. Answer. A. Vocabulary of several thousand words with understandable speech. Rationale. By age 4, speech is largely understandable to strangers, and vocabulary expands significantly. Question 20. A nurse is assessing a healthy 5-year-old child before school entry. Which developmental finding should the nurse expect? A. Skips, hops on one foot, and copies a triangle. B. Uses only reflexive movements. C. Demonstrates no social interaction with peers. D. Requires complete assistance with feeding. Answer. A. Skips, hops on one foot, and copies a triangle. Rationale. 5-year-old children demonstrate advanced gross motor coordination, including hopping and skipping, and can copy more complex shapes such as triangles. Question 21. A school nurse is conducting a developmental screening for a 6-year-old child entering 1st grade. The parents ask whether the child's fascination with collecting objects and following simple rules is normal. Which response by the nurse is most appropriate? A. Such behavior suggests developmental regression. B. This behavior is consistent with normal school-age cognitive and social development. C. Children should not understand rules until adolescence. D. Immediate psychiatric evaluation is required. Answer. B. This behavior is consistent with normal school-age cognitive and social development. Rationale. School-age children enjoy collections, organized activities, and rule-based games. These behaviors reflect increasing cognitive maturity and social development. Question 22. A pediatric nurse is assessing a 6-year-old child who can dress independently, tie simple knots, and participate in cooperative games. Which interpretation is most accurate? A. The child demonstrates expected developmental milestones. B. The child is significantly delayed. C. The child exhibits exclusively adolescent behaviors. D. The child demonstrates abnormal psychosocial development. Answer. A. The child demonstrates expected developmental milestones. Rationale. Independence in dressing and participation in cooperative activities are expected achievements for school-age children. Question 23. A nurse is assessing a 7-year-old child during a routine health examination. Which developmental characteristic is most typical? A. Enjoys peer approval and develops increasing logical thinking. B. Demonstrates only reflexive behavior. C. Requires complete assistance with self-care. D. Has no concept of cause and effect. Answer. A. Enjoys peer approval and develops increasing logical thinking. Rationale. School-age children value peer acceptance and develop concrete operational thinking, allowing logical reasoning about real-world situations. Question 24. A parent reports concern because their 8-year-old child prefers spending time with friends rather than family members. Which response should the nurse provide? A. This indicates emotional detachment. B. This is a common developmental pattern during school-age years. C. The child should never prefer peer interaction. D. This behavior indicates severe developmental delay. Answer. B. This is a common developmental pattern during school-age years. Rationale. Peer relationships become increasingly important during middle childhood and contribute to social skill development. Question 25. A nurse is evaluating the psychosocial development of a 9-year-old child. According to Erickson, which developmental task is most important during this stage? A. Trust versus mistrust. B. Autonomy versus shame and doubt. C. Industry versus inferiority. D. Integrity versus despair. Answer. C. Industry versus inferiority. Rationale: school-age children strive to achieve competence, develop skills, and gain recognition for accomplishments. Question 26. A pediatric nurse is assessing a 10-year-old child. Which finding is most indicative of normal cognitive development? A. Ability to understand conservation and perform logical reasoning. B. Exclusive use of sensoromotor thinking. C. Inability to understand numerical concepts. D. Complete dependence on magical thinking. Answer. A. Ability to understand conservation and perform logical reasoning. Rationale: school-age children function within Piaget's concrete operational stage and can perform logical operations involving tangible concepts. Question 27. A nurse is assessing an 11-year-old child during an annual physical examination. Which developmental behavior should the nurse anticipate? A. Increased concern about peer acceptance and body image. B. Complete absence of social awareness. C. Lack of interest in friendships. D. Inability to understand consequences. Answer. A. Increased concern about peer acceptance and body image. Rationale: preadolescents become increasingly aware of social relationships, appearance, and peer perceptions. Question 28. A nurse is evaluating a child who recently turned 12 years old. Which developmental milestone is expected during early adolescence? A. Development of abstract thinking begins. B. Reliance solely on reflexes. C. Inability to understand hypothetical situations. D. Permanent dependence on parents for decision-making. Answer. A. Development of abstract thinking begins. Rationale: early adolescents gradually transition into formal operational thought, allowing hypothetical and abstract reasoning. Question 29. A nurse assesses a healthy adolescent and notes frequent questioning of parental values and exploration of personal beliefs. Which psychosocial developmental task is most closely associated with this behavior? A. Trust versus mistrust. B. Initiative versus guilt. C. Identity versus role confusion. D. Generativity versus stagnation. Answer. C. Identity versus role confusion. Rationale: adolescents work toward establishing a stable identity, often exploring beliefs, goals, values, and future roles. Question 30. A pediatric nurse is teaching a group of newly hired nurses about developmental red flags. Which finding in a 9-month-old infant requires the most immediate follow-up? A. Pulls to stand. B. Uses an immature pincer grasp. C. Does not sit without support. D. Exhibits stranger anxiety. Answer. C. Does not sit without support. Rationale: independent sitting is generally achieved around 6 to 8 months. Failure to sit unsupported by 9 months may indicate a significant developmental delay requiring prompt evaluation. Question 31. A pediatric nurse is assessing a 2-month-old infant during a well-child visit. Which finding should the nurse identify as requiring immediate follow-up? A. Presence of a social smile. B. Lifts head briefly when prone. C. Absence of any response to loud sounds. D. Tracks objects to midline. Answer. C. Absence of any response to loud sounds. Rationale: infants should demonstrate a startle or response to loud noises shortly after birth. Lack of auditory response may indicate hearing impairment and requires prompt evaluation. Question 32. A nurse is performing a developmental screening on a 6-month-old infant. Which finding would be most concerning? A. Transfers objects between hands. B. Rolls from abdomen to back. C. Inability to maintain head control. D. Recognizes familiar caregivers. Answer. C. Inability to maintain head control. Rationale: good head control should be established by approximately 4 months. Persistent head lag or poor head control at 6 months warrants further assessment. Question 33. A pediatric nurse assesses a 9-month-old infant. Which developmental findings should be reported to the healthcare provider? A. Stranger anxiety. B. Pulls to stand. C. Does not bear weight on legs when supported. D. Transfers toys between hands. Answer. C. Does not bear weight on legs when supported. Rationale. Most 9-month-old infants can bear weight on their legs when supported. Failure to do so may indicate neuromuscular or developmental concerns. Question 34. A nurse is evaluating a 12-month-old child. Which finding is the greatest developmental concern? A. Uses a pincer grasp. B. Cruises along furniture. C. Does not say mama or dada meaningfully. D. Waves goodbye. Answer. C. Does not say mama or dada meaningfully. Rationale. Meaningful use of mama and dada is expected by approximately 12 months. Absence of these words may suggest a language or hearing delay. Question 35. A nurse is assessing a 15-month-old toddler. Which developmental milestone should be expected? A. Builds a tower of 2 blocks. B. Copies a triangle. C. Reads simple sentences. D. Hops on 1 foot. Answer. A. Builds a tower of 2 blocks. Rationale. 15-month-old toddlers commonly build small block towers, walk independently, and explore their environment actively. Question 36. A pediatric nurse evaluates an 18-month-old child. Which finding would require additional developmental assessment? A. Walks independently. B. Uses several words. C. Does not walk without support. D. Demonstrates temper tantrums. Answer. C. Does not walk without support. Rationale. Independent walking is generally achieved by 15 months. Failure to walk by 18 months is a significant developmental red flag. Question 37. A nurse is screening a 2-year-old child. Which finding is most concerning? A. Uses 2-word phrases. B. Engages in parallel play. C. Cannot follow simple one-step commands. D. Runs and climbs furniture. Answer. C. Cannot follow simple one-step commands. Rationale. By age 2, children should understand and follow simple commands. Inability to do so may indicate cognitive, language, or hearing deficits. Question 38. A preschool nurse assesses a 3-year-old child. Which developmental milestone is expected? A. Copies a circle and rides a tricycle. B. Solves multiplication problems. C. Writes complete paragraphs. D. Skips alternating feet consistently. Answer. A. Copies a circle and rides a tricycle. Rationale. 3-year-olds commonly copy circles, ride tricycles, and participate in imaginative play. Question 39. A nurse evaluates a 4-year-old child during a routine examination. Which finding suggests a possible developmental delay? A. Speaks in complete sentences. B. Engages in fantasy play. C. Cannot jump on 1 foot. D. Knows own name. Answer. C. Cannot jump on 1 foot. Rationale. By age 4, children typically can hop or briefly balance on 1 foot. Inability to perform these tasks may warrant further evaluation. Question 40. A pediatric nurse is teaching parents about developmental surveillance. Which statement accurately reflects expected development for a healthy 5-year-old child? A. The child should be capable of cooperative play and following game rules. B. The child should engage only in parallel play. C. The child should remain completely dependent on caregivers for dressing. D. The child should be unable to distinguish fantasy from reality. Answer. A. The child should be capable of cooperative play and following game rules. Rationale. 5-year-olds commonly participate in cooperative play, understand simple rules, and develop increasing independence in self-care and social interactions. Question 41. A pediatric nurse is caring for a 6-year-old child admitted for a minor surgical procedure. The child asks numerous questions about how the surgery will affect school attendance and participation in sports. Which interpretation by the nurse is most appropriate? A. The child is demonstrating normal industry-focused thinking. B. The child is exhibiting delayed psychosocial development. C. The child should be primarily concerned about separation anxiety. D. The child's concerns are abnormal for this age. Answer. A. The child is demonstrating normal industry-focused thinking. Rationale. School-age children are in Erickson's stage of industry versus inferiority and are highly concerned with achievement, competence, school performance, and participation in activities. Question 42. A nurse is assessing developmental milestones in a 7-year-old child. Which cognitive ability reflects expected development according to Piaget's concrete operational stage? A. Understanding that the quantity of water remains unchanged when poured into a different shaped container. B. Believing that inanimate objects have feelings. C. Inability to classify objects into groups. D. Complete dependence on magical thinking. Answer. A. Understanding that the quantity of water remains unchanged when poured into a different shaped container. Rationale. Conservation is a hallmark of concrete operational thinking and demonstrates logical reasoning about tangible objects. Question 43. A nurse is evaluating a 3-month-old infant who was born full term without complications. Which developmental finding would require the most immediate follow-up? A. Smiles when spoken to. B. Coos and vocalizes. C. Persistent head lag when pulled to sitting. D. Tracks a moving object visually. Answer. C. Persistent head lag when pulled to sitting. Rationale. Although some head lag may still be present at 3 months, persistent and pronounced head lag can indicate neuromuscular or developmental concerns and requires further assessment. Question 44. A nurse assesses a 10-month-old infant during a wellness examination. Which milestone indicates appropriate development? A. Walks independently across the room. B. Uses a mature pincer grasp to pick up small objects. C. Writes recognizable letters. D. Uses 3-word sentences. Answer. B. Uses a mature pincer grasp to pick up small objects. Rationale. A mature pincer grasp develops around 9 to 10 months and is one of the most important fine motor milestones during late infancy. Question 45. A pediatric nurse is conducting developmental surveillance on a 2.5-year-old child. Which finding is most consistent with expected language development? A. Uses simple sentences of 3 to 4 words. B. Communicates exclusively by pointing. C. Uses only 1-word responses. D. Has no understandable speech. Answer. A. Uses simple sentences of 3 to 4 words. Rationale. By 30 months, children commonly speak in short sentences, ask questions, and possess rapidly expanding vocabularies. Question 46. A nurse is teaching nursing students about developmental milestone red flags. Which finding in a 4-year-old child requires the greatest concern? A. Difficulty drawing detailed pictures. B. Inability to engage in imaginative play. C. Occasional fear of the dark. D. Preference for familiar routines. Answer. B. Inability to engage in imaginative play. Rationale. Imaginative and pretend play are major developmental characteristics of preschool-age children. Absence of this skill may indicate developmental concerns requiring further evaluation. Question 47. A school nurse is evaluating an 11-year-old child. Which assessment finding reflects healthy psychosocial development? A. Participation in peer groups and team activities. B. Complete withdrawal from all social interactions. C. Refusal to engage in age-appropriate responsibilities. D. Persistent inability to cooperate with peers. Answer. A. Participation in peer groups and team activities. Rationale. Peer relationships become increasingly important during late childhood and contribute significantly to social and emotional development. Question 48. A pediatric nurse is assessing a 12-month-old child during a routine visit. Which developmental achievement would be considered most advanced for this age? A. Walking independently. B. Rolling from abdomen to back. C. Exhibiting a social smile. D. Holding head steady. Answer. A. Walking independently. Rationale. Walking independently is a major gross motor milestone typically achieved around 12 months and represents more advanced development than the other listed milestones. Question 49. A nurse is reviewing developmental milestones with a group of new graduate nurses. Which milestone age pairing is correct? A. Social smile, 2 months. B. Walks independently, 6 months. C. Rides tricycle, 18 months. D. Copies square, 2 years. Answer. A. Social smile, 2 months. Rationale. A social smile typically emerges around 2 months. The other milestone age pairings are developmentally inaccurate. Question 50. A nurse is caring for a child in a developmental clinic. Which milestone delay requires the most urgent referral for comprehensive evaluation? A. A 5-year-old unable to tie shoelaces. B. A 4-year-old unable to draw a square. C. An 18-month-old unable to walk independently. D. A 3-year-old unable to pedal a tricycle. Answer. C. An 18-month-old unable to walk independently. Rationale. Failure to achieve independent walking by 18 months is a major developmental red flag that may indicate significant neurologic, muscular, or developmental impairment and warrants prompt evaluation.
Congratulations on making it to the end of this video. If you found these growth milestone Nclex questions helpful, make sure you hit the like button and subscribe to MCQs Master 101 for more high-yield Nclex content every week. Remember, growth and development questions are some of the most frequently tested and most commonly missed topics on the Nclex. The more you practice them, the more confident you'll be on exam day. Leave a comment below and tell me, which growth milestone question challenged you the most? And don't forget to turn on the notification bell so you never miss our next video featuring difficult Nclex questions, priority case studies, SATA questions, pharmacology, maternity, pediatrics, and critical care reviews. Thank you for watching. Keep studying smart, stay confident, and I'll see you in the next video.